All right, welcome back to the Elias Macko Show, third hour of the program. How many of you signed up for 23andMe or some other DNA genetic testing company? Well, 23andMe, big news, right? That they filed for bankruptcy, their CEO stepping down from that role. The company plans to sell most of its assets, but says it will continue operating as usual for now. However, concerns are growing over the security of customer data, especially after a 2023 breach exposed the personal information of nearly 7 million users. Privacy experts warn that a sale could put genetic data at risk. Officials in the U.S. urging customers to delete their accounts and their data from 23andMe servers. 23andMe insists that its data protections remain intact. Let's find out a little bit more. Kristen V. Brown joins us, a U.S.-based science journalist. Kristen, welcome to the program.
Hi, thanks for having me.
Why hasn't 23andMe been successful? You know, they have our DNA, for crying out loud. How can you not monetize that? Tell us more.
Oh, man, what a question. I think the problem with what 23andMe wanted to do is, when the company started almost 20 years ago, we really thought that it would wind up being like, we find one gene for diabetes, we find one gene for heart disease, and you spit in a tube, you take this test, and it tells you all the terrible things you're at risk for, and then the steps to, not get those terrible diseases. But DNA in general turned out more complicated, right? There's not one gene for heart disease. There are many, many, many genes that influence heart disease. We don't even really know how many, and they influence it in addition to your environment, your lifestyle, all these things. So it wound up that if what you care about is your health, spitting in a tube, paying the $99, taking a DNA test, it's just not that useful. The big use case wound up being if you want to fill out your family tree. And I think there's just a limited number of people who are interested in filling out their family tree, and those people have already bought the test. So, there just aren't that many more people to sell these things to because genetics just wound up not being the panacea that was promised 20 years ago.
Yeah, and just on the subject on, monetizing the data that they have, right? It's not lost on me. For crying out loud, just last week, I liked a page on Facebook about mini discs. This is an audio format from the 1990s, okay? Nobody knows or likes mini discs, okay? And lo and behold, I'm already getting advertising, right, from Meta. And they're able to monetize that. And I'm just wondering how, if they drop the ball at all at trying to think of, unique, interesting ways to monetize that data, sell advertising, do things like that, if that's part of the woes that 23andMe is in.
Right. I think that a lot of people, when they spit in that tube, they don't understand that even though this is information about your health, it's not protected in the same way that it would be in a healthcare setting. In the U.S. here, we have a law called HIPAA, right, which would protect that data if I had taken a DNA test at the doctor's office. But because I took a DNA test with 23andMe, there are no data protections. Basically, when you spit in that tube, you were just hoping that 23andMe does right by your data. And, they actually have been pretty good in terms of protecting consumer data so far. But, with a Chapter 11 bankruptcy and the potential for selling that information, which is now definitely on the table, right? It's hard to say what could happen. And there are a lot of people who might be interested in it, right? You have insurers who might want to get this data and try and use it to determine who would be good to sell a life insurance policy to. You could have people who, want to, sell you salsa without cilantro in it based on your DNA. There's just a lot of things that it could be used for. The same way, all of our information gets sliced and diced and, turned back to sell us things on Instagram.
I just logged in, right? I logged in last week because I was one of those early adopters on 23andMe. I logged into my account first time in a while, right? And I was like, oh, they have the information. They know I can smell asparagus when I go to the bathroom, right? Like it's all these little things here. Let me ask you for your take on what 23andMe customers should do right now. Last week I logged in and I clicked on all the things to download my data. I have not deleted my account, however. What's your advice?
Yeah, there are a lot of privacy experts, even some lawmakers, who have told people to delete their data. But it's not that simple to begin with. You can log in, you can go to settings, you can select delete your data and have some of your data gone. But the truth is, if you opted in to 23andMe's research projects, which, I believe the vast majority of customers did, right? That data will not be deleted. Your de-identified data that was used to, develop drugs and study genetics, that data will still be, not only with 23andMe, but with the partners that worked on those projects. Also, law in the United States, at least, requires them to hold on to some of your information for a certain amount of time. That's like a QA thing, They want to make sure that if it turns out something was wrong, they can go back and look at your data and figure out what happened, right? So that requires them to hold on to some data for a specific amount of time. So you can't really just delete it a lot of the time. And, I think whether you want to try and delete as much as you can really comes down to what the value was for you. I know that in my family, at least, my aunt has loved filling out our family tree. We have an adoption in the family, so she's been down the rabbit hole connecting with ancestors we never knew and stuff like that. And that has been really valuable to her. I think she probably won't delete her data. But, if you just were mildly curious or, your mom gave it to you as a stocking stuffer, yeah, maybe it's time to delete your data. But I think that's such a personal question, and people really need to evaluate, what did I get out of this when making that decision?
We're with Kristen V. Brown, a U.S.-based science journalist, talking about the fate of 23andMe. And Kristen, I'll tell you, I'm an early adopter. I've always been a techie. Part of the reason why I probably did this so long ago. But I also felt a little bit of nobleness, maybe by doing this, I could help cure cancer, by submitting my DNA to a database like this. I'm sure that was part of the equation way back when. And I'll read you a text message from a listener. Patty writes to us that a few years ago, she found her half-sister in New Jersey thanks to 23andMe. So there's a use case right there. What do you think happens from here? Do you think 23andMe, they go through the bankruptcy proceedings here and they find a way, a light at the end of the tunnel, and they keep things operating?
What I can tell you is that Ann Wojcicki is the most stubborn and determined CEO, co-founder that I have ever encountered in my many, many years as a tech and science journalist. And I think if there is a way to save the company, she will find it. Whether there is, I don't know. I think that's hard to predict. But I think what's certainly true is that she wanted to start a healthcare revolution with this data, bringing people personalized healthcare advice. And I think the science is just not there at this point to do that. What we've gotten instead is, people connecting with long-lost family members and cops using these kinds of databases to find killers, right? So it's not that we've gotten nothing, but we didn't get what at least Ann Wojcicki set out to bring people.
Who are the other players in this business? I think of 23andMe, who are the competitors in this space? And maybe does this industry need, merging in order to save itself?
Yeah, the biggest competitor, I think, is Ancestry, right? Which has been around for a really long time and started, even pre-DNA, just offering people software to help fill out their family tree. And Ancestry tried the healthcare thing and they abandoned it after just a couple of years because they saw that the biggest use case was just the family tree stuff and not bringing people healthcare insights. And a lot of the other players in the, at least the health portion of the consumer DNA space, they have pivoted at this point. And 23andMe is really the only big player left really trying to bring people healthcare insights from their genetic data. Everybody else has pivoted, dropped it, decided to do something else.
I've been such an early adopter of this stuff. I even did Embark. I did it for my dog. The dog DNA. Are they still around, by the way?
I tested my cat. Yeah. I think Embark is around. Yeah, I tested my cat, and it was really funny because we know so little about cat genetics, and my cat is gray and white, and it said that she was genetically black, which was really
it's off base, a little off base. Okay, listen, Kristen, great discussion. Thanks so much.
Thank you for having me.
That's Kristen V. Brown, U.S. science journalist.